Well, welcome back to RC Hospice Talks. We're in Season 2, Episode 7 of a series we're entitling Everyone Has Lost Someone. I'm Tom Rupp, I'm chaplain, and with us today we have...
Emily Gwendon, RN Case Manager with RC Hospice.
And Emily's been so kind as to share some of her stories of hospice care with loved ones that she has had to say goodbye to. So we're going to let Emily take it from here.
All right. So my first experiences with hospice would have to be my grandparents. I lost my grandpa while I was in high school, and I had actually started my medical training then, so I was already in medical assisting, so I kind of knew what was going on. And he had suffered a massive stroke, which left him paralyzed on one side of his body. He had dysphagia, so he wasn't able to swallow. He had a NG tube that was placed for tube feeding. And a little background on my grandpa was he was a Navy man. He was one of the strongest men I knew. He was an engineer, and he was always in control. So it's hard when you see someone like that who suffered a stroke and he was basically trapped in his body. He was discharged home on hospice, and we have a big family, and we were able to give him the care he needed there. We had hope that he would get better, that his strength would regain, that he'd be able to start eating, but that didn't happen. I'm thankful, though, that we did have the hospice team because he had the comfort medications he needed. We were able to have all of the equipment there that we needed. We were directed in how to keep him comfortable. And he was doing pretty good. We had him for a month after his stroke. He eventually coughed up his NG tube, and he didn't want it put back in. Even though he was paralyzed on one side of his body, he kind of communicated with the strong side by waving his hand. And I was actually able to be at his bedside, helping my aunts care for him, bed baths, and I wasn't allowed to give any meds, but I was allowed to push water through his feeding tube, and I learned how to declog a feeding tube. But I was grateful that hospice was there, even though we at times had false hope, and partly on our part that he was going to get better, but they were there and he was comfortable, and he passed comfortably at home.
Thank Emily for sharing that story, and I talked to her before we started filming today. I know she has at least one more. Good stories of loved ones, and before they went, their experience with hospice. How about another?
My dad's mom, when she passed away, she actually passed away the day before my 19th birthday. She was living in a nursing facility, and it was, her diagnosis was kind of hard because it came on suddenly. They don't quite know what happened. She may have had a little stroke when she was sleeping, or a TIA, but we weren't quite sure. She lost the ability to swallow, so she also had dysphagia, and it got to a point where my dad, who is her decision maker, had to decide whether she was going to get a feeding tube or more do the comfort hospice route. And he had a hard time deciding that. And thankfully, my grandma was still alert enough that she told him, no, I don't want a feeding tube. And she did go on to hospice.
How long was she on hospice care before she passed?
She was actually only on for a few days. She had to transfer facilities because the care that she needed was increased with her hospice care. And when I got to visit her, I visited her a lot before her hospice care. And when I did get to visit her while she was on hospice care, she was asleep. She was comfortable though. She was asleep, and she had still gotten her medication. She was comfortable. Her breathing wasn't labored. She looked peaceful. I had watched my grandma sleep before, and I had seen when she was restless and when she was talking in her sleep, but she was peaceful. And when she passed away, it was, I don't know how to say it. It was a peaceful moment. I wasn't there, but it was like she was finally at peace. She had a long life where she was very sick for most of it, and in and out of the hospital and living in a nursing facility, and it was like she was at peace and she was back with her husband. All right, so this next one is the story of my mom's mom. She was a nurse, and I was very close with her. My grandma was 89 when they found that she had a tumor in her lung. And she went back about 3 months later, and it had grown significantly. It started off like a size of a pea, or a little bit more like a dime, nickel maybe. And it had grown to the size of like a cookie or a plum, pretty significantly. And her being a nurse, she wanted it. She was an oncology nurse for a little bit, and she worked on a cancer floor, so she didn't necessarily want treatment right away. She just wanted to see what type of cancer it was. And she went in to get it biopsied. However, due to the location of it, she had a 50-50 chance of having a pneumothorax afterwards, which would be a very uncomfortable weekend and probably a hospital admission. And she decided instead to more sign up on a palliative hospice route and go home. The family, we always supported Grandma. I know a few struggled with her choice, but the doctors, just due to her scans and her progression, did give her about 6 months to live. So she went home, and she just kind of took every day by day. She was independent. She was still managing her little apartment. She'd still have chest x-rays once in a while, or see her cardiologist. She did get scanned for a ultrasound, not really a scan, for a blood clot in her leg. So she still had those options while she was on palliative care. And her team, as she transitioned, just did it based on symptom and her care. And eventually, when she wasn't always independent. She was still walking with a walker, but she had to have someone there. We don't quite know how large her tumor got or where it grew when she did pass, but we took it day by day, and we're very thankful for our hospice team, because Grandma had quite a bit of symptoms that we wouldn't have known how to manage because of the location of her tumor. She had shortness of breath sometimes, and she was on a steroid for that, and the steroid caused agitation, and you can only imagine this sweet woman who's baked cookies all your life almost agitated with you. It was very hard to see sometimes. And she had a lot of confusion, which was hard because you'd be there taking care of her, and she wouldn't always remember who you were.
Yeah.
But one thing that we were thankful of is the questions that Grandma had were answered with when she wanted them answered. So when she had symptoms of a DVT, which is a blood clot in the lower leg, she had her ultrasound done, thanks to palliative. And when she did want to see that if her tumor was growing, she could go and get that chest x-ray. And then when she transitioned more to the hospice route, she got the things she needed for her pain. She was on scheduled morphine, and she had morphine at the end. When she passed, she was actually up to the bathroom. It was the middle of the night, and she had gotten up to the bathroom, and she went into respiratory distress, and by the time she got back to bed, she was asking for her morphine because she wanted just her breathing to be in control. And I wasn't there, but my aunt, who's a nurse, also tells the story very well. She got her morphine, and her breathing started to calm down, and she fell asleep. And she passed peacefully.
Thank you, Lord.
But she was up and independent and using the bathroom before she passed, which I don't know if she'd like that being shared, but that's a big goal for a lot of my patients, is to continue to have their independence as much as they can.
Yeah. Well, as you can see, Emily's stories are very heartfelt. We appreciate you opening up your heart a little bit.
Yeah.
For many of us, that's more difficult to do, or especially not without tears. And that's okay. That's the thing. That's okay. Now, you may have questions, not only about hospice care, but palliative care. And we here at RC Hospice can answer such questions. And if you'd like to call us, please do so concerning palliative care or hospice care at 1-916-858-1440. Very glad to have Emily with us today, sharing from her experiences. Thank you, Emily.
Thank you, Tom.
Cool.